Affordable healthcare reform is incredible. People love it. People hate it. People are overwhelmed by the details. Nobody knows what is going to be happening in October of 2013 when we're formally pulled into it, much less January of 2014 when it really begins. We are intimidated. This next guest is going to simplify and cut through the nonsense. Please welcome my good friend, Mr. Sean McGuire, everybody. He's a healthcare reform expert. Sean McGuire.
Hello, man.
Hey, man.
How are you?
Great.
Yeah, thanks for having me.
My pleasure. Good to see you. How's your show going on Coil? I think you're doing that on the Mighty 1290, every week, right?
I am. It's going well, and we just got a first affiliate in North Platte and McCook, and we're
You're
hoping to take
you're in the
message.
syndication market.
We're working on it. We're working on it. Got a
Awesome.
lot of important things to get to the folks out there. There's a lot of transformational change, huh?
It really is. You're riding a fast pony, and so you're riding it to North Platte.
That's right. That's right. And
Great.
hopefully.
Well, listen, how do you take, just give us a sense. There's some people out here that probably still don't fully understand. We're talking about what, a 2,000-page document, took 2 years to write.
Yeah.
Give us
I call the Affordable Care Act, sometimes it's kind of like an Anchorman when they put the question mark behind the teleprompter and Ron Burgundy said Affordable Care Act, because there's a lot of questions if it is affordable.
Yeah.
But I call it the Bigfoot.
or affordable for who, right?
For whom,
Yeah.
correct, yes. And I call it the Bigfoot of American law because it's kind of like an unknown law. 52% of America still thinks that it's not passed yet. That's incorrect. It's been a law for 3 years already.
Is that right?
Yes.
52,
Coincidentally, the same amount of people live in Bigfoot, around 52%.
There you go. So
it's kind of, is it the man in a suit or what is it?
it is the Bigfoot of America's culture. You know,
Yes.
somebody told me the other day. They said, "What do you think is the biggest issue in America today? Is it education and the problems we have there? Is it immigration, or is it healthcare reform?" I'm going to assume that you're going to say healthcare reform
Yes.
is the pivot around which everything.
I think it's the big driver to our federal debt, which we're $16.4 trillion as a nation in debt. For everybody in the room, that's $52,000 each that we owe, and it's growing. And
These Creighton students already owe a little bit of money on their
Well, of
education
course.
anyway, and they're going to owe another 52 grand. Okay.
It's really troubling for the millennial generation, of which I'm toward at the upper end of that millennial
You're a senior
generation.
millennial,
I'm a senior
yes.
millennial. But we're going to have to pay a lot more because of this debt that poor leadership in Washington over several decades has gotten us into. And I think
I appreciate you saying over several decades.
Yes.
I mean, it's real easy to pin it on President Obama, but it really is
it's a generational thing. I really
cumulative
believe.
and generational thing. It's really associated with the baby boomers and their vision of what their life and their country is all about.
Right.
What if you're a small business person, and I know they're, it's under 50 employees and over 50 or
Yes,
something, right?
The magic number is 50 employees, and what that means is a business with more than 50 full-time equivalents, and a part-time worker can technically be considered a full-time equivalent if they work more than 30 hours now.
Okay, all right.
So that's the new normal, not 40, it's 30. And a business with more than 50 full-time equivalents has to offer health insurance or pay a non-deductible tax beginning next year. And so you're seeing a lot of restaurants, everybody's favorite bistro with 4 locations or sports bar. A lot of these individuals and companies have to offer this new expense or face a huge tax. And it's to the amount, if it's a big restaurant location, for example, that it could be a whole store's revenue for the year could be gobbled up by a tax.
All right,
that's
no,
non-deductible.
really?
Yes.
I mean, a restaurant, a good-sized
Let's say
restaurant.
a restaurant with 4 locations.
Well, let's say every location does $1 million, $1.25 million, all right, in revenue.
Okay.
All right.
What's their margin on that?
Well, their margin, if they're full service, is going to be around 15 or 20%. If they're fast food or casual, it'll be about 10%.
Okay. So they're clearing about, what, 100,000 out of that million?
So they're doing about $5 million in gross revenue, and their total margin is going to be close to 20% of that.
Okay.
So about $1 million.
They're clearing $1 million.
About that.
Okay.
So
that
tell
will-
me what
Well,
now.
they're taxed, if they have, say that individual has about 200 employees, their tax in 2014, if they do not offer health insurance that meets the standards, is $2,000 times every single full-time worker minus the first 30. So what's 170 times 2,000?
Minus the first 30 employees? Mm-hmm. Okay.
So 170 times 2,000, it's a little bit over 300,000 that this is the new tax that's looming for.
So that's
for these
going to wipe
industries.
out 60% of their gross margin.
Yes, and this is reality. This is obviously law. It's section 4980 of the new tax code. Of course, they said it was a penalty, but the Supreme Court said it was a tax. And it is a tax. And so people need to basically begin preparing themselves for this, because unfortunately, many of our leaders in private industry are burying their heads in the sand still, instead of trying to wrap their hands
bitching
around
and
this.
moaning and whining,
Yes.
and they're in denial and so on. Let's talk about that. And I almost wish we had some of our bankers and some of our attorneys that we talked earlier today sitting at the table.
Right.
Maybe
Next time you could do a round.
maybe we can do a Wild Biz and do a forum about that. But what is a legitimate? I mean, number one, you pass on the cost to the customers.
Right.
All right. That's going to be the first thing. Just add it up. Divide it up among all the menu items to stick with the restaurant concept, incrementally and proportionately divide it out, and just up all the pricing on the items.
Right.
Is that what most business owners are going to do?
That's one response. Another, again, I mentioned the new normal, the 30-hour worker. So you're seeing a lot of restaurants potentially reduce their hours for certain workers to under 30 hours, to 29, 28 hours. And so that means these people, young millennials who are trying to work to save for their college over the summer, can only work 28 hours potentially, because otherwise they're a risk to the company having to offer health insurance or pay this new tax.
All right, so cut everybody back to less than 30 hours somehow. That's another way to get through it.
That's one.
Here's another.
That's we call that the roaring 20s, where you get them and offer coverage to your up to 30 and then part-time for everybody else.
Yeah, that's good.
But how's that going to impact quality too, Lynn?
Yeah, that's it. Well, quality in terms of the product delivery that they're delivering, or
if it's
or of health care.
Well,
there's a receiver
let's
and a
talk about
deliverer.
both. Yeah, but just take the industry example of a restaurant. Like, how is that? All right, so the consumer's paying more. The worker has less of an incentive to work because they have only 28 hours. They're probably going to have to work 2 now. So do you think they're going to be trying as hard if they were had a full-time?
I don't know. I don't know really the answer to that question.
Kind of one of those unknown knowns.
Yeah, they might actually step up the performance just to hold on to it. But of course, they're not going to have health insurance, so what's to hold on to?
Correct. Do they sit? Well, if they get burned out on that one, do they just immediately leave?
Here's a crazy idea. How about we get rid of all companies that have 50 employers or more? All right, get rid of them all and bust them all up. By the way, Charles Handy, this is not as crazy as it sounds. Charles Handy, who's arguably the most brilliant business person alive today, from Oxford, he goes around the country and tells big companies like IBM and other companies that ultimately they're going to have to unbundle their entire firm because they cannot be nimble enough to respond to the incredible changes in their marketplace. And they should emulate W.L. Gore out in Maryland, who has nothing but all these incredible small committees running all these businesses worldwide. They're very nimble, they're very quick, they're very responsive, and there isn't 25 employees in those companies. There's 10 or 15, at least in terms of running the company. And this is the business model of the future. Maybe this becomes a catalyst for that. Wouldn't that be interesting?
Oh, I think you're right. I did some graduate work and we studied organizational theory, and they're talking about that. My beef is it the government's role to determine if that should be how the market should be structured? I mean, philosophically.
Well, it's a catalyst, though. Maybe it just moves us off the dime and we start thinking more creatively anyway.
Well, I think that's important. But just on the last point all right, if they had all these companies and they were just, instead of one giant 200 organization, there were 10 and all these different things, the law would still look at that aggregate group and they still would have to offer coverage.
Really? Well, forget that idea.
I guess.
All right. Mr. Sean McGuire, ladies and gentlemen, with healthcare reform right here. Edie Bellis. A round of applause. Great.
Thank you.
Awesome. Excellent. Vigorous dialogue. We'll be right back on Wild Biz Weekly. Thanks so much for watching us on wildbiztv.com. See all the other videos on this platform. This is where Omaha's thought leaders congregate and share their inside secrets to their career, their business, and help you make an informed purchase decision. Thanks so much. I'm Lynn Hinderaker. Bye-bye.